Tonight, we are continuing our series on the fentanyl crisis in West Virginia. In this latest edition, 12 News' Jefferson Pan takes a look at a strategy in addressing the fallout of the crisis that's surrounded by controversy. Jefferson joins us here live in the studio with more. Jefferson?
That's right, Eric. In the state's last legislative session, syringe service programs were under fire as legislators debated whether to pass a law to ban them. Advocates say syringe service programs save lives, while others say they do more harm than good. I talked to voices on both sides of this issue with this report. The LIGHT program in Morgantown is one of the leading syringe service programs in the state. LIGHT follows a philosophy of harm reduction, or that a part of a public health response to a drug crisis should be to lessen the negative health effects of people who are addicted. In the case of the syringe service program, they argue that users are going to use opioids regardless of whether they have clean syringes. By providing clean syringes, LIGHT says it decreases the spread of communicable diseases like hepatitis and HIV.
We're not giving people drugs, we're not encouraging people to do drugs, we're accepting the fact that this is our reality right now in West Virginia. Monongalia
County Delegate Gino Chiarelli was the lead sponsor of House Bill 4866, which proposed banning syringe service programs. Chiarelli says his position is partially based on an experience he had while going undercover and using LIGHT services.
There was no coordination of care of any kind. There was no treatment planning. There was no specialist referrals. I was in there for about 15 minutes, and I walked out of there with a plastic bag full of paraphernalia.
LIGHT has said that it has since fixed the errors that Chiarelli exposed. It also points to the CDC, which says syringe service programs are proven to save lives and reduce the impact of drug use in the community. A major area of contention in the syringe service debate is whether the programs produce syringe litter that could pose a public health threat in their own right. LIGHT and the National Institutes of Health contend that syringe service programs do not increase litter, but Chiarelli argues that what the research says is not borne out by his experience living in Morgantown, nor what his constituents say.
I don't really care what the CDC says about these kind of statistics, because I have two eyeballs and I live in this community. I have ears and I hear what the other people are saying, what people that are living it and experiencing it every single day. People refuse to go downtown anymore. People don't want to take their kids to the library. People don't want to participate in whatever they have downtown because of what's happening there and the things that they're being exposed to.
Perhaps one of LIGHT's biggest achievements is that it says, unlike most West Virginia cities, Morgantown has not had a needle-borne HIV case in the past 9 years. When asked about the human toll that banning syringe service programs might cause, Chiarelli said that between the litter he sees and the ease with which people can access needles, he thinks programs like LIGHT do more harm than good. Ultimately, House Bill 4866 was not passed, and LIGHT's syringe service program is still in operation. But with the issue being so contentious, syringe service programs are likely to be back on the agenda in the next legislative session. 12 News will continue to monitor the status of syringe service programs and keep you up to date. Our series on the fentanyl crisis continues tomorrow with a special report from 12 News' Gwen Napier about efforts by WVU Medicine to help babies who suffer from neonatal abstinence syndrome. Reporting live in the studio, I'm Jefferson Pan for 12 News.